And although COVID-19 has dominated the discussion of vaccines in the past couple of years, there's another serious illness that, while it has been around for a lot longer, still presents a cause for concern. Newswatch reporter Catherine Skeldon has the story on why people should keep this vaccine in mind as well.
Pertussis, or whooping cough, is a serious respiratory illness that, according to the American Lung Association, only 30% of adults have the vaccine against. Being highly contagious, the organization is working to educate and encourage people to get the vaccine, especially those living with asthma or chronic obstructive pulmonary disease. Health professionals say that fall is when whooping cough is on the rise, making it just another reason to go ahead and get the shot.
Pertussis is a bacteria that affects the respiratory tract. And it can cause a lot of nasal congestion and, more importantly, inflammation of the airways, and can lead to cough that can be prolonged and shortness of breath. And in individuals who aren't treated, it can go on to have complications of pneumonia, hospitalization, and even death.
And unfortunately, with COVID still going around, symptoms between it and pertussis can be easily confused. Chief Medical Officer of the American Lung Association, Dr. Albert Rizzo, says that the only real way to determine the difference is to get tested.
The same test that looks for COVID does not find pertussis. Influenza diagnosis does not find pertussis. So this has to be an infection thought about by your primary care doctor, because if it's identified early on, it's definitely treatable with antibiotics.
Rizzo says that while pertussis is more contagious in children, they receive a regular shot for it, unlike adults. He says that actually people need to get the shot every 10 years. Catherine Skeldon, Newswatch.
You should speak with your healthcare provider about getting Tdap, the shot that protects against whooping cough. You can also visit the American Lung Association on their website to learn more.